The CPT codes in this section can be reported under the condition that the procedures, services were performed by or under the responsible supervision of a physician and/or certified registered nurse anesthetist. Coding professionals should keep in mind that they are selecting an anesthesia code based on the surgical procedure performed. The anesthesia section of the CPT codebook includes codes that are described as general and regional anesthesia services and supplementation of local anesthesia and/or supportive services. These services should be reported by the physician who provides or supervises the anesthesia. The Anesthesia Services 00100 through 01999 in this section include usual preoperative and postoperative visits, anesthesia provided during the procedure, and administration of fluids and/or blood, and usual monitoring services such as EKG, temperature, blood pressure, oximetry, etc. The codes in the anesthesia section are arranged first by body site and then by specific surgical procedure performed, and they may be found in the alphabetic index of the CPT codebook by referencing the main entries of anesthesia or analgesia. For anesthesia services, it is important to review third-party payer rules and regulations for submitting CPT codes. For example, time is used instead of a CPT code. Counting the anesthesia time should begin when the preparation of the patient by the anesthesiologist for induction of anesthesia, usually in the operating room, and end when the anesthesiologist no longer is in attendance. When reporting anesthesia services, a physical status modifier code should be used to distinguish between various levels of complexity of the anesthesia service provided. The anesthesiologist usually provides physical status modifiers on the anesthesia record. The ranking of the patient physical status by the American Society of Anesthesiologists is consistent with the following modifiers: P1, normal patient; B2, a patient with mild systemic disease; P3, a patient with severe systemic disease; P4, a patient with severe systemic disease that is a constant threat to life; P5, a moribund patient who is not expected to survive without the operation; and P6, a declared brain-dead patient whose organs are being removed for donor purposes. Under certain circumstances, other modifiers may be assigned. The following modifiers are commonly used with codes from the anesthesia section: 22, 23, 51, 53, and 59. Modifier 47, anesthesia by a surgeon, is never used as a modifier for the anesthesia procedures in the CPT codebook. Range is of 00100 through 01999. Also, HCPC Level 2 modifiers are applicable to anesthesia services. Qualifying circumstances: when anesthesia services are provided under difficult circumstances because of the patient's condition, operative conditions, or unusual risk factors, an additional code may be reported along with the code describing the basic anesthesia service. Codes 99100 through 99140 can never be reported alone. Located in the medicine section of CPT codebook, these codes, number 99100 through 99140, are described as follows: 99100, anesthesia for patient of extreme age under 1 year and over 70 years. 99116, anesthesia complicated by utilization of total body hypothermia. 99135, anesthesia complicated by utilization of controlled hypotension. And 99140, anesthesia complicated by emergency conditions. When code 99140 is reported, a separate report must be submitted describing the type of emergency. According to the CPT codebook, an emergency exists when delay of treatment of a patient would significantly increase the threat to life or a body part. Because the anesthesia codes were developed to represent the professional services provided by anesthesiologists, the anesthesia codes cannot be reported by hospitals unless the hospitals perform billing services for the anesthesiologists.